Good afternoon and welcome to healthsystemCIO.com's All-Stars panel, Data Governance as a Key to Quality Analytics, a webinar tweet chat combo from healthsystemCIO.com sponsored by Collibra. Just a little housekeeping before we get started. My name is Anthony Guerra and I'm the Editor-in-Chief of healthsystemCIO.com, and I'll be your moderator today. We are having a simultaneous tweet chat hosted by our Managing Editor and Director of Social Media, Kate Gamble. You can participate in a separate browser or on your phone by using the hashtag HSCIOchat, or you can simply view the tweet chat in the Media Viewer panel on the right-hand side of your screen. We'll also be using the Q&A panel today. You can type your questions at any time into the Q&A panel, send them in to all panelists, and we will take those later in the program, but go ahead and send them in as they occur to you. Just so you have an idea how we're going to spend our time today, we're going to go about 45 minutes or so, and our panel consists of Kirk Hanson, Director of Enterprise Data Governance with Geisinger Health System, Jeremy Hubbard, Executive Director, Unified Administrative Systems and Data Governance with Loma University Health, and Chris Cooper, Healthcare Sales and Strategy Leader with Collibra. So without further delay, we are going to jump right in. Kirk, why don't you start us off? Can you give us an overview of Geisinger?
Sure. We're an integrated healthcare delivery system. We've got 4 main entities. The first is our clinical enterprise, comprised of like 7 hospitals and 50 primary care clinics. Our second entity is our health insurance arm, Geisinger Health Plan. Third is a research organization called the Henry Hood Center for Health Research. They're very involved in some pretty hot topics these days, genomics, precision medicine, that sort of thing. And our fourth is our newest. That's a medical school, the Geisinger Commonwealth School of Medicine.
Very good. Thank you. Jeremy, an overview of Loma Linda.
Sure. Loma Linda University Health, we're an academic health science center based primarily in Southern California. We have 6 hospitals and 8 schools, all centered around the health sciences. We also have 10 research institutes, and we're growing a lot. We're expanding into other parts of the country and around the world, so I'm excited to be here.
Very good. Thank you, Jeremy. Chris, a little bit about Collibra.
Thanks, Anthony. Great to be here with everyone today. Collibra is a software platform vendor that's focused on providing tools and capabilities to support the data governance space. We've been in business for about 10 years and work with a number of industries specifically focused on healthcare and financial services. And what we provide is that governance platform as software or managed service that really enables organizations to jumpstart their governance efforts.
Very good, very good. Okay, let's move on to our next question. Kirk, why don't you start us off and just give us an overview of your analytics program, what it looks like today, sort of the high points of it that you want the listeners to know about.
Sure. We consider ourselves to be fairly far along the maturity curve in terms of enterprise analytics. We've got a number of different platforms. Some of the classics. We're using a lot of the business objects products. We use Crystal Reports extensively. Is kind of our backbone. It's where we started, and of course, once you start an analytics program, it tends to take a life of its own. We deliver a self-serve capability using Business Objects Web Intelligence platform. We've had success with that, although at some points we'd have to characterize it maybe as mixed success. Self-service analytics is a lot easier to. It sounds a lot better when you're talking about it around a conference room table than it is to actually execute. And then more recently, we've onboarded some very powerful tools like Tableau and Click, and we've got some that are probably not as familiar to our audience. one called AltoSoft, which has been a workhorse for our organization and actually kind of moved us up a couple levels in terms of delivering analytics to our user community.
Okay, so a lot of different things in the mix there. Jeremy, you want to give us an overview?
Yeah, sure. So actually very similar to what Kirk mentioned, we're also an Epic client. So, you know, the BOE Crystal is obviously has been a backbone for a while, but, you know, frankly, when it comes to Webby and kind of our self-service strategy, we felt like it was, SAP just wasn't keeping up and that it was too slow. And so a couple of years ago, we made a strategic effort to really enhance and upgrade our environment to focus primarily on Tableau for self-service, and gaining some horsepower through some additional things like Cisco DV, SAP HANA to, you know, kind of provide the thrust that we need to manage, you know, some really large data marts, and it's been, I'd say we've been very successful. Primarily centered around self-service for executive dashboards and certain key operational KPIs that, you know, our organization has been challenged to face from a quality standards perspective. That's been our primary focus. But as a academic health sciences center, we're also trying to divest more, if you will, into the academic side of things as well. So that's kind of, Tableau has been, I would say, more universally user-friendly for us in that respect.
Chris, we've heard a lot of names just come up in the two answers. Give people a framework of how to think about these things. Where does Collibra fit in terms of functionality versus some of the things we've heard? And I've also heard quite a bit of names, and what are some integration issues between all these applications when we think about the results we're trying to achieve?
Yeah, sure, Anthony, and certainly I think you know, your question really alludes to one of the things that we see very common across a lot of the health systems and health plans that we work with on a regular basis. It's not that organizations aren't making significant investments and expending significant energy to really drive their analytics programs, but the challenge is they've reached a point where they have a high level of fragmentation. There are lots of silos of analytics, different tools that are provided by EMR vendors, other application vendors, strategies put in place to support that self-service approach. But the result, often from an end user perspective, is really additional confusion around what are all the options out there. As we all know, people really expect a high level of user experience across their organization, and bringing a lot of the commercial activities from outside of their life, working with Amazon, working with LinkedIn, working with best-of-breed technologies from a consumer experience. When they start to work internally, often they find lots of different silos that are very disconnected. And certainly we are seeing organizations that are starting to think about how do I connect the dots across these various silos? How do I remain consistent in my understanding of information as I move from those legacy analytics, some of the operational things that are provided by my application vendors, my throughput, my operational reporting that are provided, you know, fairly effectively by EMR, other application vendors, but really needing to be able to connect that with some of the more advanced analysis that's being done to really drive the organization. And so bringing that together, really helping users across the enterprise find the appropriate data assets, then effectively understand what that reporting asset or what that data asset means is a big part of what Collibra is focused on. And organizations are now looking to say, how do I go beyond a single tool or single platform? How do I start to maintain some consistency, knowing that over the next 3 or 4 years we'll continue to see products from a self-service analytics from a BI tool perspective come and go. We'll see reprioritization. User interfaces dictate a lot of that adoption. But how do you maintain some institutional consistency as we move between those environments? And so certainly Collibra's approach is to really be complementary to a lot of those analytics and BI tools to really make the information that's needed for understanding relevant to the organization and accessible in the context of using that analysis, using that information to more effectively answer their questions across the enterprise.
Very good. Kirk, let me follow up on something that you had mentioned. You talked about self-service being easier to sort of discuss at the boardroom level than put into practice. So there's a big difference here between having technical people produce reports for end users, such as the clinicians, and trying to put the tools in the clinician's hand and sort of skip the middleman. Is that a correct way to think about it, that if you want to actually have your clinicians be able to do their own queries and produce reports that are relevant to them, that's a whole nother step in this process?
Yeah, I think you're hitting the nail right on the head, Anthony. The challenge in self-service is there's no shortage of very bright folks out there who want to use the data to pursue their innovative ideas, and it's not that they're not clever enough to use the tools. What they lack is kind of the background to understand the data at a sufficiently detailed level to be able to use the tools effectively. And really, the traditional way of gaining that background simply isn't available to them. It's not practical to ask a physician who, arguably has a more than full-time job to spend a lot of time understanding the intricacies of a data source, schema, so that he can figure out, if it makes sense to join a couple different data elements, and if so, what the right way to join those data elements would be. It's the paramount challenge, really. And the solution, we think we're on the right track here. The solution is to provide not that understanding at a really technical level, but a sufficiently detailed understanding so that the data makes sense to these clinicians. We're having a lot of success with the tool that Chris's company represents, the Collibra Data Governance Center, in being able to provide to our business users a much more I hesitate to use the word simplified because it's not really simple, but it's a much clearer representation of the information that the business user who's trying to make some headway in the analytics space. It's a much clearer representation of the information that he needs to have so that he's successful in building those analytics.
Jeremy, you want to weigh in on that? I mean, this is the critical thing we need to accomplish, right? We want to get IT and the data folks out of the middle. We don't want to have Mr. Clinician sit down with a sort of data scientist and try and explain what he's trying to achieve or learn, and then have a consultation there. I mean, that's easy enough, right? That can be done, but that's what we're trying to get away from, correct?
Yeah, absolutely, and it's something that at Loma Linda we talk about data literacy a lot, or data literacy, and what we define that is kind of bridging that gap between what I'll call the quote-unquote regular people, which and it can be clinicians or physicians. I mean, these are smart people, but they're not data scientists. And for us, it's something we also call, data democratization. So if the platform is difficult, we know it's not going to be used, and it has to work equally well for multiple teams. Incorporating, your institutional policies and procedures via the tool is important, but for us, I think that the point that we really try to drive home is we have to have engagement from the business and from the operation in order to be successful. And the way that we do that is through our data stewards. That is a role within our organization that we live and die by. And in some cases, those data stewards are physicians, but I would say that it's pretty rare, just due to the points that were made earlier about their time limitations and times they have to spend in clinic, et cetera. They don't have the time that it takes, to really sit down and to go through and to do all the validation in order to clean up your data marts. But once you can sit down and you can work directly with a data steward who is a subject matter expert within that field and can really help, guide us in terms of building the infrastructure that it takes to then hand that over to a physician and say, okay, go have fun, go crazy. It takes time to do that, but once you do, it's worth all the investment, because then, that kind of becomes that aha moment where, all of a sudden, it works, and they can be assured that, the data quality, accuracy, reliability of it is all there and present.
Very good, very good. Chris, let's go to you for our next question. What are some common mistakes and best practices you've gleaned working with many customers?
And I think that fits actually very nicely with Jeremy's last point. It's driving value back to the organization is certainly one of the things that we see as absolutely critical. Time and time again, organizations have started data governance programs, very much looking at how do I document this? How do we get agreement on these business terms? How do we put the structure in place from an organizational perspective, thinking of the govern part of governance, which is certainly valid. But what we are really seeing is those organizations that are having strong success from a governance perspective look at governance as an enabling technology, thinking about really the end before beginning. So thinking about what value are you providing back to information users, information consumers, or as we like to refer to them, data citizens. How are you providing value back to the organization? Simply having a documentation system, typically it's tough to keep people engaged in that process. So you need to think about how do you quickly provide value for that information that you're starting to increase and improve the organizational knowledge around. And certainly we see this challenge of needing to scale. I love Jeremy's term talking about really analytics literacy, data literacy, being able to expand that. How do you grow that pool of people who are literate? And so providing that additional context along with the data, with the analysis that they're doing, whether it's a definition that is well known, whether it's providing information that you can very quickly understand. How was this metric or how was this report calculated? What data was used as an input? What is the quality of that information? Those types of things really help the organization become more effective versus organizations that look at governance as a more structured approach that is simply a documentation process. So it's thinking about how do you engage the users, how do you engage business consumers in that conversation very quickly and on a regular basis.
Very good, Chris. I want to follow up with you because it's relevant to the question. You mentioned that Collibra is active in 2 industries, healthcare and financial services. We just published an interview recently with Chuck Christian, who's a longtime CIO and now with Indiana Health Exchange, who said he's tired of comparisons between healthcare and financial services, and I think his point is that healthcare is a completely different animal and much more complicated. Having worked with both kinds of organizations, are there any relevant comparisons, any things you can glean from financial services that are relevant to healthcare, or is it really not fair to healthcare to have those comparisons made?
I think that there are some comparisons, although I do agree that you have to, in some ways not overstep those comparisons. I would say from, our perspective, really both industries are industries that are facing a significant amount of change, whether it's from a regulatory perspective, from a market dynamics perspective, but facing change, very data-rich industries, although healthcare is certainly newer to its data challenges than perhaps financial services. But we do see different priorities. Certainly, I will be the first to acknowledge, and I think most of my colleagues will as well, that the breadth of data across healthcare is significant and creates some unique challenges. I would say, historic lack of strong IT engagement within healthcare and really capabilities and skills introduces some new challenges. And there's also a literacy from a data perspective. I would say there's a bit more work that we have to do from a healthcare perspective, although I do think that there are similarities. Both industries are highly focused on operational efficiency. Certainly they are both very data-centric in their operations today. And I would say that both industries do have significant pressures from a regulatory as well as from an information protection and privacy perspective that need to be considered. Typically, most folks really get concerned when it's either their financial information or their health information that may be at risk. And so I think that those are things that unite in the way of trends. And I think that healthcare can certainly learn things from maturity from a largely data processing perspective that we see in financial services to understand, what are the limitations from a data processing perspective, where is there an opportunity for additional governance maybe prior to regulation being imposed on an industry, because certainly financial services has been facing that, and I think we will continue to see additional regulatory pressure within healthcare over the years as we start to become more structured and more focused on how we're using, collecting and using data across the industry.
Excellent. Thank you very much for that. Kirk, let's go with you. How did your organization begin the implementation of its data governance process? Big bang type thing? You just start small in one department and expand out from there?
I think I would have to characterize it as, well, definitely not big bang. More toward the starting small end of the spectrum, Anthony. About 4 years ago, a number of our executives, let's call them the more data-minded executives in our organization, across those different entities that I mentioned earlier, they got together and started talking about maybe some of the things that weren't working so well with our data strategy, our enterprise data strategy, and they began to imagine, 5 years into the future, 10 years into the future, 15 years into the future, to get a handle on, where do we want to be at those different points. They formulated a strategy. And they took it to the decision-making body within our health system, presented that idea, which became known at the time as the unified data architecture. And as a key component of the unified data architecture was the idea of data governance. We'd had a sense for a number of years that our sort of laissez-faire approach to data governance simply wasn't working for us. So as part of this unified data architecture initiative, the decision was made to resource a formal program. The formal program stood up about 2 years ago, and it's, it was rather modest in its beginnings, and I guess I would tell you that we're still a fairly modest program in terms of size and budget, but not necessarily in terms of effectiveness. I think we've shown in the couple years that we've been organized, that we can deliver value far and above the resources that are given to us. And that's been key to our growth. We're not necessarily growing by leaps and bounds in terms of the number of persons in the data governance office, but we are getting considerable support for some of the additional tools that are needed to really accelerate, to really multiply the impact of a data governance program.
Very good. Jeremy, how did your organization begin its program?
It's somewhat similar to the journey that Kirk described. I think it was a hot topic, especially post-Epic, which is our EHR platform. We went live with Epic in 2012, 2013. And at the time, I think it was kind of a mad scramble, like a lot of people go through, anytime you're going through a major, EHR conversion, upgrade, transition like that. And so it was probably, I would say, somewhere in the neighborhood of 2014, 2015, so 3 to 4 years ago, that we took a step back and, had, a couple years worth of data, and there was all these reports that were being generated, and people kind of asked the question of, well, long-term, what is our vision for analytics? And that's when the topic of data governance arose. And so it started off, actually, ironically, with basically an institution-wide policy that was very high level, that was written, by executives and published by the executive board, and I'm sure very few people in the organization even knew it existed. But they were, kind of now bound to this, law that this is the way that we want to do things. But then from a programmatic standpoint, we actually hired a consultant initially to essentially devise a program charter and try to get it off the ground, and it just wasn't successful. So when I joined the team 2 years ago, it was kind of still in a fledgling state, and at that point, I asked the elephant in the room question of, well, what is our overall strategy in terms of, are we going to take more of a centralized or a decentralized approach? And that was something that I think hadn't really been considered quite yet, and so we were very intentional about pursuing more of a decentralized approach, where we are housed within what we internally call decision support, which is traditionally more clinical operations support, but we divested to include, budgeting, finance, IT. So it was sort of this amalgamation of different analytics teams and then data governance. And we started small, and basically we just did a road show and realized, that the first thing that we've got to accomplish is we've got to make sure that there's a level of foundational awareness across the enterprise, that this is something that we need, is of value in terms of our ability to grow the analytics program. And so we spent, honestly, the first 6 months just going around and meeting with people, talking to them, kind of trying to proselytize, if you will, and evangelize the data governance gospel. And then beyond that, we divided the organization into a series of segments and asked them to nominate or knight their data stewards. And so we now have about 120 data stewards that are spread across the organization that we have essentially trained and, kind of in the ninjutsu of data governance. And they are our eyes and ears in the organization. And we believe that once we fully mature into the university and other areas, we'll probably have 200 to 300 of those data stewards. So that's really been kind of our approach, has been, more of I'd call it kind of the grassroots militia movement. And in part because we're just a very diversified organization, and we tend to kind of operate in silos where the academic side and the healthcare side don't always talk to each other, and that's obviously something that has to happen if you're going to be successful in your data governance efforts.
Very good. Chris, do you want to, either react to what Kirk or Jeremy has described about their programs and your thoughts on that, or overall, if you want to talk about a best practice for getting started? Chris?
Sure, and I think there are a couple of things that I would think about, and certainly we have, lots of these conversations as organizations are starting to feel their way through a governance program. And certainly I think, certainly conventional wisdom holds in the sense of, start small, don't try to boil the ocean. But again, I'll tie back to this concept of really thinking about what value are you providing back to the organization, back to the constituents. Certainly it's one thing to say, hey, we're going to start to form some structures, some committees, we're going to start working together, we're going to ask, data stewards to take an active role and do some things, but it's important very much along with that to communicate what's the value to the organization, what's the benefit, and look for those key wins where you can enable new capabilities. And certainly one of the things that we're seeing across our Epic customers as broadly is starting with things like a report catalog, being able to understand what reporting assets exist across the organization, making it easy, single place to say, across business objects, across Tableau, across all of my analytics solutions that are out there, how do I find information that may be relevant to me quickly as an information consumer? And then, who can I go to? Who can I ask questions? What do I need to understand? And so taking that position of, identifying who are the constituents that you're providing value back into the organization as part of your governance program, I think is key. And then thinking about governance really as a ongoing, sustained activity. Governance is really not a project. It is a program. It is a way of living that really enables new capabilities for the organization. And it's difficult sometimes for organizations to really say, hey, we're going to fund new headcount on an ongoing basis for something that we can't quite measure the value of. And so establishing those metrics, getting those early wins, providing that value back to the executive team, to key sponsors fairly quickly in a couple of month time frame can really help justify that existence as you grow and expand. And certainly, understanding that, as much as the technology, you're dealing with the people in the process, and so it is incremental change over time. And certainly, we see that those organizations that are successful have strong champions like Jeremy, like Kirk, who can really champion these efforts over time and provide that consistency when sometimes organizational priorities might be refocused elsewhere. Being able to keep that sustained momentum, have that roadmap is critical to long-term success.
Very good. Let's go to the next question. Jeremy, let's start with you. Low-hanging fruit, let's take that first. What are some easy wins that folks can get out there on the data governance front?
Well, I think, it starts with, establishing kind of a framework of what do you want to accomplish. I think, you kind of have to start with the end in mind. The good news is that, you talked earlier, Anthony, about, comparisons between financial services and healthcare, and obviously we like to think that we're really unique in that respect, but I like to tell people that, even though I understand, from a vertical perspective, you can go really, really deep on the, the particulars of how healthcare is different, but data governance as a discipline has been around a long enough time now that really there has been a good foundation that's built, and there's a lot of resources that are out there, whether they're on the internet or, textbooks. I mean, there's classes, certifications, et cetera. So I would say start there in terms of educating, whoever is really kind of taking the charge, you've got to start with, educating yourself, and then talk to other, neighbors and clients as to, lessons learned, how have they been successful, what have they done, and what would you advise? I mean, the biggest thing that I tell people is if you can start with data governance, you're better off. I think that's one lesson learned for us is anytime there is a data conversion effort or there's a new system that's going to be put in place or things like that, that is, I see as low-hanging fruit, as an opportunity for you to engage data governance. So I'll give you a good real-life example. We're in the process of consolidating 6 different financial ERPs onto one single cloud platform from various corporations within the Loma Health System. And thankfully, the people who are leading the project came to me about 6 months ago and said, hey, is this something that we should be talking to data governance about? And I said, absolutely, and I'm so glad that you guys are, engaging in this conversation ahead of time, because the earlier you can get involved, I think the better off you're going to be. And also, I think the other thing that I would say is kind of low-hanging fruit is look to the maturity models that are out there. The one that we have kind of used as our, guiding principles, if you will, is the Stanford model. But it's applicable beyond, and it's, obviously it's more particular to healthcare, but I think it's applicable beyond. And it's free, it's online, you can just Google Stanford data governance model, and they've got a really good, kind of Likert scale of maturity in terms of people, process, technology, and kind of what are the things that you should be looking to do in order to advance in your data governance program.
Excellent advice, very good. Kirk, your thoughts around some low-hanging fruit?
Well, I'll tell you something, Anthony. When we first started a couple of years ago, we had this idea that that we would search for some low-hanging fruit, some quick wins, some things that would be easy to do to quickly demonstrate the value of the program. We identified a few things. It turned out none of them were hanging quite as low as we thought they were. None of the wins were quite as quick as we thought they would be. But still, the process of working through those projects was instructive. The focus for us was then, and it continues to be, we still have very much we think of ourselves as a startup, and I think if we ever lose that mindset, we're at risk. So we're always looking for those projects where the effort the effort to value ratio is favorable. That is the lowest amount of effort necessary to achieve the success of the project. But the payoffs are, significantly higher than the effort that you're putting in. And one of the measures for that, of course, is, who's impacted. You could have a wildly successful project that only affects, a small handful of your stakeholders. That's not going to be nearly as effective if you're trying to communicate the value of the program as if you had a project that was maybe a little less impactful, but spread out across, broad sectors of your organization. The idea is to generate some enthusiasm, some momentum for the program, because as that momentum grows, the support for the program, either in real terms like budget dollars or just in terms of goodwill, folks willing to willing to listen when you have a suggestion about, what it would, what would enhance, the overall governance effort, what would deliver more value to the enterprise. They're just more receptive. So, we did just what I described. We started with a pretty long list of projects that that were candidates to begin, and selected from that list a pretty small handful, and systematically worked through those. And in some cases we were a little surprised that we didn't get the recognition that we hoped that we would from achieving, from completing a project. But in other cases, we got the effect that we were looking for, and in some cases even more of an impact. That's sort of a strategy. It's not exclusive to kicking off a data governance program. I think it works probably in a lot of endeavors similar to that. But it's a useful strategy, and if someone's just starting out, I think they would be wise to begin there.
Excellent. Chris, do you want to talk about some things that you've seen work well, or that you've gone to places and you see people doing that you say, oh, wow, that's pretty effective?
Yeah, I would certainly say a couple of things that we're seeing, as I mentioned, that concept of, enabling that enterprise report catalog, being able to find what are the data assets available, being able to answer the question behind key metrics the organization is measuring itself against, whether it's, key executive reporting, being able to understand, what is this metric that we're measuring. Being able to answer those questions are certainly key values. And then just providing additional context and understanding around information. And certainly we're seeing a lot of organizations enabling and building out their catalogs of data assets for the organization to be able to work with, whether that's reporting assets or data sets, or even what are the underlying technical tables, columns, data assets that are available in the organization. Starting to answer those questions really gets people engaged and then much more willing to invest in helping to maintain and facilitate that process over time.
Very good, very good. All right, next question. Start with you on this, Kirk. Do you have tools or processes by which the EDW is automatically updated when data definitions or measures are changed through the data governance process?
For about 5 years now, we've been using, the Informatica tool set to do this kind of work for us. For our technical users, Informatica is very powerful. Where we've adoption with the non-technical users, with our business users, who are far and away the majority of the folks that we're trying to serve, not just with the data governance program, but with our greater data management program. It's the business users, and Informatica, that tool set, as good as it is really designed for the technical user in mind. It's an ETL tool, so you might imagine that it's gonna cater to the ETL, to the technical segment of your data management community. So we've been looking for tools that would kind of crack that barrier, that are more accessible to the business users, that would provide the same information that's available in the Informatica tool set, or at least the parts that are meaningful to our business users, but in a much more accessible way. The tool that we're having quite a bit of success with, again, it's the tool that Chris represents. It's the Collibra Data Governance Center. We're getting the reviews from our business user community are very good. The couple use cases that we've implemented since we started with the tool in May have achieved very high levels of success, and we're very optimistic about the additional value that we'll be able to gain from a tool like Collibra going forward.
Excellent. All right, we're going to, for time's sake, we're going to move on, and we'll go with you, Jeremy. How would you describe the level of data governance maturity at your health system?
I would say that, we're probably on a, if we were to rank it on a scale of 1 to 5, we're probably at a solid 3, 3.5. I think in terms of awareness, we've done a really good job of informing executives. They understand the program benefits, how it impacts their organization, knowledge of their data stewards and what the expectations are for them. I would say from a, more of a tools perspective in terms of how do we actually link back, our data dictionary and all of our metadata that is within our analytics framework to the efforts that are ongoing within data governance. We are less mature, and part of that is just ongoing discussions around where are we going to, invest from a technology standpoint. But really, I mean, we are, I would say, we're still making progress. It's just not as automated as I would like it to be. But we have, defined what, what the metadata collection validation responsibilities are. We've assigned those out. People are actually actively doing the work. It's just more in a kind of an old school fashion, if you will. So that's kind of, I think, the next evolution in our journey is going to be helping to connect those dots and to, really automate it so it's not people having to, keep copies of things on spreadsheets and then, manually updating dashboards.
Very good. Kirk, let's go with you on this. Who is sponsoring or championing your data governance program? And I assume you think that how you're doing it is the way to go, so let's hear about that.
Well, we like to think we're on the right track anyway, Anthony. Well, our Enterprise Data Governance Office is accountable for the Enterprise Data Governance Program. The Director of Enterprise Data Governance, that's me, reports to our Chief Data Officer. But it's a mistake to think that that we're localizing the data governance effort within the Data Governance Office. Our team, it's a small team. And I just can't imagine that our data governance office, or really any data governance office, needs to be a large team. I like to tell the team that we make our impact on the organization by integrating the work of others. It's maybe a little bit underhanded, but we very actively recruit folks, form them into project teams, and in some cases with very light touches, in some cases with maybe a slightly more heavy-handed approach, we guide those project teams of individuals who are not part of the data governance office to achieve whatever the deliverables of the project are. It's a tricky strategy, and it relies on the kindness of strangers in some cases. But if it's done right, it can be very effective, and especially in terms of the enterprise's investment in the data governance resources, it can be a very successful approach.
Chris, have you, in the organizations you've gone in, have you seen any sort of structure you think of as a best practice as far as, the reporting, the sponsoring and championing goes?
We have certainly seen, I think, probably every conceivable, organizational structure and reporting. Certainly we see greater success in some cases than others, but I think it has less to do with the structure or who is the champion and more about really what is the alignment and organizational commitment. Certainly we see organizations being driven from the bottom up that deliver good success, and those are often coming out of a VP of analytics or director of analytics really driving a ground-up need. Certainly we see organizations who have taken a much more top-down mandated approach where there's strong executive support, and while that has a lot of benefit, it can also introduce some of its own challenges as you try to get the organization to move forward in a timeline that executives really want to see results. So it is we see lots of different flavors. One of the things that we are seeing is that there is more and more need for that chief data officer, CDO type role. We see that a lot of CIOs are stepping in and helping to fill that role. But what we are seeing is a new executive career path around that chief data officer that often is being populated or is being fed from folks who have started from an analytics perspective. And so I think there's a new career opportunity for people with a strong data and business background to contribute to those discussions. And certainly I think that it has opened up a new executive career track that hasn't been open in a long time, and I think is a unique opportunity for people who really have a passion and drive to push this forward.
Very good. I'm going to push us a few more minutes. We're having such a great conversation. I want to try and go about 5 more minutes. Let's get an audience question in, and I want to put it in front of you, Jeremy. How big a price is, quote-unquote, how big a problem is, quote unquote, price of discovery around data governance issues? That is, are people afraid to turn over rocks and size up problems? What are some of the best ways to address this?
Yeah, I mean, I think that does tend to be a problem. But you know, my attitude toward responding to that is, I think the cost of not knowing, could be severely more than just kind of sticking your head in the ground and pretending that it's going to go away. And when we started our journey, we had 4 guiding principles that we knew we wanted to follow. The obvious ones are, standards and consistency around creating our data definitions, improving data quality and accuracy, and improved processing, et cetera. But really at our core, the things that we also wanted to, focus on were, 1, maintaining regulatory compliance. Obviously we want to make sure that we are keeping executives out of orange jumpsuits. And then last but not least, we wanted to be a data-driven organization. And we knew that in order to do that, you can't leave any stone unturned. I mean, there really is no excuse for it. You have to be willing to kind of get down in the mud and really do some heavy lifting at times. And frankly, I've been at the table with some very confrontational folks in our organization. People who have just unbelievable clout, and from a political standpoint, as well as just kind of their overall history and background, and primarily physicians, and physicians that I highly respect and are just incredibly talented, smart, giving people who our organization would not be able to function without. But at some time, it takes you kind of, standing toe to toe and, and kind of, fighting through those things and just saying, hey, look, we both want the same thing. But if we don't address this issue now, it's only going to continue to kind of, permeate. And when you can, talk in their terms in terms of saying, hey, look, what we think this is potentially symptomatic of a bigger issue, and start to, kind of level with them on their field, if you will, I think that they respect you for it. Oftentimes, at least in our organization, physicians tend to kind of have that trump card where they'll just say, no, I don't want to comply, or, I'm going to do it a different way, and nobody challenges them on it. And so one key thing for us has been getting physician buy-in, so that way you can have peers who are willing to kind of engage in that adversarial conversation at times. But again, you can't leave those things untouched. Otherwise, it's just a disease that's going to continue to fester, and then eventually it's a really big problem that you don't want to deal with at that point.
All right, very good. I'm going to ask you guys one more question, and then I'm going to let you go. And let's start with you, Kirk, because you touched on this, the idea of resources, the idea on your data governance department, or whatever the proper phrase is to use, having a large effect with a minimal or relatively minimal investment. Let's talk about, and we have to make this relative because we have probably folks from all different size organizations on the line. Is there a way for people to think of the proper amount of resources to dedicate to this endeavor? Is there any way we can put some sort of structure or give people some idea that they can go back and say, wow, we don't have enough resources at all for what we need to do here, or we're pretty good, or we're way over the mark? I'm sure you're not going to get a lot of folks there, but Kirk, your thoughts on resources that need to be devoted to data governance?
I'm sure this is common across all organizations that either have a functioning data governance program, or among those organizations where data governance is just a twinkle in somebody's eye right now. You'll never have the budget that you think you should have, and you'll never have the size of the staff that you think you should have. But that's not actually a bad thing. Especially in a healthcare organization these days, where the financial pressures are enormous, and they're frankly, they're getting even, it's getting to be even tougher. Your data governance program, you want it to be as inexpensive as possible, because you don't want it to be viewed as as a cash cow that somebody, if they cut you in half, or they, even worse, eliminate your program, that it relieves some kind of financial pressure on the organization. You should, the leader of a healthcare organization's data governance program should actively seek to keep his program as inexpensive as possible, to avoid finding himself in the budgeteer's crosshairs, so to speak.
So a little bit of flying under the radar there.
Well, in terms of your resourcing, yes, you don't want to be high profile there, but you certainly don't want to fly under the radar in terms of effectiveness. You want to be seen as not just a good value, but an enormously good value. So, with that concept in mind, what does it take for you to achieve some sort of a positive effect? Certainly, it's going to take at least one person, ideally, who can be full-time dedicated to data governance. It's difficult if you have to wear too many hats, if only one of those hats is data governance. Hardly any of us, we all do better as a team, so, you want a little bit of a team behind you, a couple or three folks behind you, and you should keep it, at least in our experience. Maybe this isn't a universal, but at least in our experience, the folks who are doing data governance work don't have to be, folks who have the really expensive skill sets. They don't have to be, real senior analysts, or either technical or business analysts. A lot of the work of data governance is just kind of gritty stuff, and if somebody is engaged and willing to learn a little bit, you can take some bright young man or young woman right out of school and teach them the basics. It's a large part of your team. 2 or 3 out of, say, the 4 members of your team can be entry level. This is a formula that's worked well for us, and by doing that, and doing some of the gritty work that others don't want to do, you find that it's a lot easier to recruit some of those more talented skill sets to fill in where you need a little bit of that kind of work, in kind of an ad hoc basis. You recruit them onto your project team when you need them.
Very good. Well, Chris, I'm going to give you the last word. We just have a few more seconds here. So your thoughts on what Kirk was saying and advice for people structuring their program and devoting resources to it.
Sure. And I, like to always start with, you really don't achieve a journey like this until you start taking steps down the path. Organizations we see spend a lot of time analysis paralysis, trying to get their organizational structure right, trying to get their the way they're going to organize their assets right. Really starting in the process, listening to your organization, being receptive to feedback, and knowing that this is an evolutionary journey that you're engaged on, I think are all key activities. And then certainly having the fortitude to stick with it when there's resistance that does come up, because it will. Understanding that results may not be as quick as the organization would like to see, or even personally you would like to see, but it is about that measured progress, and certainly putting in place some basic metrics so that you can understand where you've been, because as we all know, it's difficult to remember the details of all of the challenges that we face on a daily basis, and so being able to show that incremental progress, I think, is key for any organization. And know that even if it's a single individual, you can make an impact. You can grow when you start to show that success back to the organization. So think about how you can prove your worth and provide value quickly, measure that progress over time, and be open to the fact that there will be change. You're not going to be able to plan everything perfectly.
Excellent, excellent, very good. Well, I want to thank everyone for joining us today. We sent a link out in the chat box to take our post-event survey, so please click on that link. Today we need you to actually click on the link to get to the survey that's been sent out in the chat box, so go ahead and do that when you get a moment. Regarding continuing education credits, attending our events gets you one CEU towards the CHIME CHCIO certification program. Let CHIME know you were here, and if you've asked us to do so, we will. If you need a certificate of attendance for another CEU program, you can use the final slide in this deck. You'll receive an email when our archive recording has been posted to YouTube. If you'd like us to produce a webinar on the topic of your choice, you can reach out to Nancy Wilcox on our team. You can go to our website to see our upcoming schedule. So with that, I want to thank our panel very much, Kirk Hanson, Jeremy Hubbard, and Chris Cooper. I want to thank Collibra very much for sponsoring the event, and I, of course, want to thank you, our readers and attendees, for joining us once again on another webinar. So with that, everybody have a wonderful day. Thank you.